Hi, we are student pharmacists from the Daniel K. Inouye College of Pharmacy. My name is Ann-Janin Bacani.
And I'm Michi.
Our two other members are Tomomi Kohno and Cheyenne Garretson. And today we will be presenting our webinar on anxiety disorders and management. This presentation will be covering the following topics of an introduction to what is anxiety, types of anxiety, risk factors and causes, signs and symptoms, tips on managing anxiety, and treatment options and resources to seek help. First topic we will cover is about anxiety. A couple of facts about anxiety is that anxiety disorders are the most common mental disorders in the United States. Over 40 million adults experience an anxiety disorder each year. According to the WHO, 1 in 13 people around the world suffer from anxiety, and only about 1/3 of those suffering receive treatment. Those suffering from an anxiety disorder are not alone. According to the American Psychological Association, anxiety is an emotion characterized by feelings of tension, worried thoughts, and physical changes. It is a normal response when confronted with danger, but if it is overwhelming or the feeling persists, it could be regarded as an anxiety disorder. People with anxiety disorders usually have recurring intrusive thoughts or concerns which hinders with their daily lives. Anxiety is common and affects everyone at different points in their lives. Next, we will be talking about types of anxiety. There are 6 common types of anxiety disorders. First is generalized anxiety disorder, which is an excessive recurrent worrying about daily life that one is unable to control and affects daily living for a period of at least 6 months. Next is panic disorder, which is a disorder involving repeated panic attacks occurring unexpectedly. Phobias and specific phobia is the disproportionate fears of objects of situations which provokes instant fear of anxiety. Agoraphobia is an anxiety-causing avoidance and fear of places, citation, or things, which may induce a panic attack and cause you to feel helpless, stuck, or embarrassed. Social anxiety disorder is a strong fear of being judged or embarrassed in a social settings to a degree that can interfere with your social interactions in both a professional and personal settings. And lastly is separation anxiety disorder, which is an overwhelming fear or anxiety about separation from someone to whom you are attached. Next is risk factors and causes. There are several risk factors, which includes genetics. People with family history of anxiety have a higher risk of developing anxiety. And depending on gender, a review of 48 international studies have found that women are nearly twice as likely to experience anxiety than men. According to a review by the University of Cambridge, pregnant women, people below the age of 35, and those with long-term health conditions are liable to experience relatively high rates of anxiety. Researchers say that anxiety disorders are increasingly being recognized as important determinants of poor health and major contributors to health service use. Other characteristics that are believed to heighten risk include the causes from traumatic event or past trauma, mental health problems, genetics, alcohol misuse, some illegal street drugs, and some prescription drugs. Next is signs and symptoms. Signs and symptoms of the disorder include fuzziness, which is trouble concentrating or thinking about anything, traumas, which is repeated episodes of sudden feelings of intense anxiety, and phobias, which is a major anxiety when you're exposed to a specific object. Physical symptoms of anxiety includes lightheadedness, sweating, nausea, feeling edgy and or restless, shortness of breath, diarrhea, and getting easily fatigued. A person with anxiety may have anxious thoughts that include believing the worst will happen, persistent worry, all or nothing thinking, overgeneralizing, which making an overall assumptions based on a single event. They may also display anxious behaviors, including avoidance of feared situations or events, seeking reassurance, second guessing, irritability and frustration in feared situations, and compulsive actions.
Next, we will talk about tips on managing anxiety. So the do's and don'ts to responding to someone experiencing anxiety. First, we wouldn't enable. It's common to want to help your loved one avoid painful situations that can come from anxiety. So continuing to modify behavior or the environment to accommodate your loved one's anxiety can unintentionally enable the anxiety to persist and grow. Avoiding difficult situations doesn't give your loved one the opportunity to overcome fears and learn how to master anxiety. Next, we would not be forceful when we confront someone experiencing anxiety. Trying to push somebody who's not ready can damage that relationship and the trust that they have for you. And learning how to overcome deep apprehension is work best done with a professional therapist. We do want to provide validation. So saying something like, I can't believe you're getting upset over such a small thing, belittles a person's experience. Instead, ask your loved one how you can provide support during challenging moments. Their anxiety doesn't have to make sense to you. It's important to understand that what the person is experiencing is real and requires sensitivity. Next, we would want to express concern. In the moment, there's not too much you can do to shorten the duration or noticeably lower the intensity of a panic attack. Approach your loved one in a warm and positive way and start a dialogue by saying you've noticed certain behavior changes. Tips to manage anxiety and stress include taking a time out. That could include practicing yoga, listening to music, meditating, getting a massage, or learning relaxation techniques. Stepping back from the problem helps clear your head. We also recommend to eat well-balanced meals. Do not skip any meals and do keep healthful, energy-boosting snacks on hand. Limit alcohol and caffeine, which can aggravate anxiety and trigger panic attacks. Get enough sleep. When stressed, your body needs additional sleep and rest. Exercise daily to help you feel good and maintain your health. Practice taking deep breaths, inhaling and exhaling slowly. Count to 10 slowly, repeat, and count to 20 if necessary. Always do your best. Instead of aiming for perfection, which isn't possible, be proud of however close you get to managing your anxiety. Accept that you cannot control everything. Put your stress in perspective by asking yourself, is it really as bad as you think? Welcome humor, because a good laugh goes a long way. Maintain a positive attitude and make an effort to replace negative thoughts with positive ones. Learn what triggers your anxiety. Is it work, family, school, or something else that you can identify? Write it in a journal when you're feeling stressed or anxious and look for a pattern. Lastly, talk to someone. Tell friends and family you're feeling overwhelmed and let them know they can help you. Talk to a physician or a therapist for professional help. It's important to know when to seek professional help for your mental health. If you notice that you or a loved one is experiencing anxiety that is starting to affect the ability to enjoy life, interactions at school, work, or hangouts with friends, or causes other problems at home, you should encourage yourself or a loved one to make an appointment with a mental health provider. Some might feel uncomfortable with the thought of seeking help, so this quote by Dr. Joseph McGuire explains that the first step to seeking help is similar to an annual physical exam, except for your mental and emotional health. Lastly, we will be covering treatments and resources to seek help for anxiety. 3 primary treatments for individuals with anxiety include psychotherapy and cognitive behavioral therapy, or CBT, which is a common type of talk therapy working with a mental health counselor. CBT helps you become aware of inaccurate or negative thinking so you can view challenging situations more clearly and respond to them in a more effective way. It involves learning how to lower anxiety and face distressing situations. Medication management with antidepressants is also a way to treat anxiety, which works well on its own, but is even better when coupled with CBT. SSRIs and SNRIs are often the first-line treatment for anxiety. Common SSRIs include Celexa, Lexapro, Paxil, and Zola. Common SNRIs include Pristiq, Cymbalta, and Effexor. CBT teaches you how thinking styles affects your emotions and behaviors. Therapy allows you to learn new ways to change your thinking patterns and habits. With CBT, practice is essential and involves work, but that work yields results in better mood, better relationships, and more effective behaviors. There are other types of treatment therapies, which include exposure therapy, which gradually exposes an individual to the feared situation in a safe, controlled environment, and group therapy, which is an effective mental health treatment that encourages people to communicate with others and explore their emotions instead of hiding them. If you would like to learn more about anxiety, the Anxiety and Depression Association of America or the National Alliance on Mental Illness are great places to start for community resources for additional support. You may also visit a local center such as the Cognitive Behavioral Therapy Center of Hawaii, which provides psychotherapy services for all adults and adolescents. You can schedule a free 25-minute in-office consultation to discuss how CBT might help change your life, mood, and relationships. These are our resources. Thank you for watching our presentation on anxiety disorders and management.